We're going to start with our next speaker. So if I can have those with plates at least take your seats and we'll begin. All right. By the way I relieve stress is to eat lots of cookies and yellow drivers on I-95. So at least it makes me feel better. Dr. Aimee Sanchez-Zadak is a professor at Nova Southeastern University in the Behavioral Sciences Department. In 1995, Aimee graduated with a master's degree in mental health counseling and received her doctoral degree in education leadership and human services in 2007. In 2009, Aimee was diagnosed with breast cancer. Along with Dr. Marcia Silver, another breast cancer survivor, they formed a partnership to co-write a blog titled Dr. Boob S and Dr. Boob Z. The blog is structured to answer questions on the psychosocial effects of breast cancer. Aimee serves as the secretary and a member of the board of directors of the Florida Breast Cancer Foundation. Whether we like to face the facts or not, divorce and separation are issues all too often when someone has a diagnosis of breast cancer. A study conducted by the Huntsman and Stanford University School of Medicine found that the overall divorce or separation rate among cancer patients was 11.6%, similar to the population as a whole. However, researchers were surprised by the difference in separation and divorce rates by gender. When the rate when the woman was the patient was 20.8%, compared to 2.9% when the man was the patient. In other words, a woman is 6 times more likely to be separated or divorced soon after a diagnosis of cancer than if a man in the relationship is the patient. The study also found that the longer the marriage, the more likely it would remain intact. It is my pleasure to call on Dr. Aimee Sanchez-Zadak to present It's Not All About Me, How Breast Cancer Affects the Family. Aimee?
Thank you. I came in this way because I didn't want Maxine's dream to be my reality either. And maybe she was dreaming about a female, and it was me. A couple of things. The Dr. Boobs and the Dr. Boob Z, we started that a few years ago, probably about 4 or 5 years ago. And I just want to introduce my colleague over there, Dr. Marcia Silver, and she's the S in the boobs part. So. Okay, so we're going to discuss a little. I'm going to move away from the podium. I'm not really a fan of the podium. I want to see you all. One of the things that we do is we take a look at the way we think. We take that concept of how we think and we generalize it, but we very quickly realize that everyone reacts differently. One of the common things is, well, I can do it this way. Why can't they? As survivors, how many survivors do I have in the room? How many caregivers? Okay. So what we do as survivors is we kick into gear of the flight or fight syndrome. So we're surviving now as soon as we receive that diagnosis. So let me give you a couple of, so you can see what the survivors look like. And I don't think this is working. Hold on, I'll just go the old-fashioned way. Okay, so we take a look at survivors, and survivors can be anywhere from your dog, your mother, your father, your daughter, friends, neighborhoods. So when we look at survivorship caregivers, what we see is that we have quite a bit of demographics to deal with. Biggest key is, and when Russell brought up the 11.6%, what we have is males tend to be our caregivers. So what happens is that males, ladies, and I think you'll agree with this, think differently than we do, right? Just a tad bit. So what we do is we have certain expectations, but the communication process of, I'm sorry, I'm gonna have to move back here. The communication process of having them care for us the way that we would care for them doesn't always work that way. What happens then? Then what we find is there's a psychological dysfunctional communication level between the two, and then certain problems arise. What we find is that spouses, children, become secondary survivors. They see themselves not as a victim at all, but in a way what happens is that they're struggling with a worse symptom, which is that they feel helpless because they want to fix your problem. However, what happens is that you're the one who's doing all the work, and they're basically just doing what they think they need to do. So it causes a lot of secondary survivorship behaviors, and I'm going to go into that in a little bit. The diagnosis we need to understand is not solely owned by the patient or the person with cancer. This is what studies are showing. Studies are showing, there was a study done in 2012, and what they found was they took 117 spouses and 110 children. Children ranged from the age from 6 to 30 years of age. Obviously, that's a big age gap. So what happened was that we found that there were certain results that came out of this study. The dynamics was totally different. The behaviors were totally different. The emotional distress was very different. Children, 6 to about 10, handled the diagnosis very well. It would all depend on how the patient reacted to the diagnosis. So they were mimicking their mother's behavior and attitude. So if you went on with a positive attitude, that's what they were mimicking that. They felt that energy, if you will. If it wasn't, then they would react. Now, their reaction was, again, totally different. Temper tantrums, misbehaving in school, all that. I'm going to jump to the probably 20 to 30 group. They exhibited more signs of fear. Fear because now, is it inherited? Is it genetic? Am I going to experience the same thing my mother experienced? So this is one of the things that you found in that age group. Most dangerous age group, adolescents, of course. Okay. Now they're trying to find their own identity, but they've lost someone who is the foundation of their identity, and they don't know where to go. They are your caregiver because they want to take that role, but who's really helping them emotionally with the fear? And they became our high risk psychologically as a survivor. So we can keep that in mind. The anxiety kicked in, depression. Did they act out? Yes. It was very difficult to measure because how does a teenager act out? Right? So they lash out, they roll their eyes. Okay, these are typical behaviors. Or they can be withdrawn. Those are the same conditions that we see in every teenager. However, it was at an escalated level. Okay, so we take a look at what happens. Why does breast cancer affect the caregiver so strongly? Well, we're shifting their responsibility. Again, how many of you are in control of your life and run the house at some times? Survivors? There we go. So it's a large majority of the room, clearly over 50%. So what you find is that your caregiver now becomes you, which they may not want that role. Secondly, now they have to become educated. They have to be educated on the diagnosis. What do I do? What should I expect? And then wait for your lead on what you want. So there's a lot of signals coming their way. Then we have, during hospitalization, then it really has to kick in. They really have to kick in to find out, again, your needs, and yet work with themselves to be healthy, strong, emotionally, which becomes a huge challenge. They start with, if you start a new treatment, they definitely need to learn that aspect of it, the effects of the medication, because they are caring for you. And you may have that habit of, oh, okay, I'm okay, don't worry about me. But they do. So there's keep in mind, I want you to visualize as survivors and as caregivers, all the mixed signals that you're getting. I have to do this is my responsibility, but at the same time, I don't want to not do what you don't want me to do. Okay, so simple example is you take your medication, it's time to eat. I'm not hungry, I don't want to eat. okay, do I follow that lead? Or do I pressure her into having something to eat because I know this is what she needs? So again, it's that strong challenge. How to monitor your side effects. And again, keep in mind a visual of this, the caregiver is a bystander. They're sitting on the sidelines watching you. It's gentlemen, for those gentlemen in the room, you can probably see this when, the coach is in football and they're watching a specific play and you guys are yelling on the sidelines, but there's not much you can do. And for you, so this is basically what happens. You're on that sideline trying to give them certain plays, but the reality is, ladies, that sometimes we're not reciprocating, and we make it a little tougher. And then again, the management of the medical emergency, which is what happens if? What do I do if? And how do I know if that happens, what to do? So those become great challenges. Okay, so this is what we found. We have a total shift of identity. How many of you like change? Right. Men, how many of you like change? Not much. We don't tend to like change. And what happens is that when change comes, we have anxiety, mood disorder, stress, family conflict, and coping. So first, the anxiety and the mood disorders. And this is when they start getting a little edgy or kind of leaving the house for 2 hours when they said you were going to leave the house for 1 hour. So you've got a lot of things going on, and they need breathers. The key is to stop and breathe. And Dr. Antoni he was phenomenal, because what you sit there and you take a look at how our minds work, and one of the things that we need to understand is what are our trigger points. And although this slide is for really to educate you about what the survivors are going through, you're probably a lot saying, well, I went through that as a patient. I had to change my role from someone who's strong and is in control of the house to someone now that has to be cared for, and how difficult is that? So these slides are very, very similar to each other. In reality, you're both going through the same psychological processes, yet you both have different goals and reasonings behind it. So it becomes difficult. Communication becomes difficult. The caregiver tries to be passive. So if you're being passive outwardly, what's happening to you inwardly? And as everything, a lot of students come to me and they say, I'm really, really stressed out. And I always ask, what does that mean? And then we have a long talk about what stress is. Because what we learned is that there is no such thing as stress. It's how we see the situation. So stress is really a non-valid word. The question is, I'm feeling nervous, and then my question would be, about what? And then we have this conversation. What happens to these students is when they're feeling anxiety because of test taking, midterms, finals, what they do is a week later, 2 weeks later, you see a cold surface. So they're getting sick 2-3 weeks later. Same thing they found happens to the caregivers. They'll develop nervous anxiety, panic disorders in some cases, 2-3 months after you are all okay and settled, because then the mind says, okay, now I can react. Now I can relax. And then we start seeing the symptoms. So what are the symptoms? Well, sometimes we have the immobilizing thoughts. And again, these slides are very parallel to survivor and to caregiver. So the immobilizing thoughts are fear, doubt, and worry. Remember the demographics I gave you earlier, excuse me, which was, the age group, the husbands, but then the children. So the fear of the children and the fear of the adult are all the same. Fear is fear. They're afraid of you losing you. That is that's the root of the cause. But how many of us have that conversation of, is that what you're afraid of? And if you're afraid of it, let's have a conversation with it. We have a habit in Western civilization to keep things in, and definitely not to speak about it, especially when you're sick. So I urge you all to speak about it. Will there be tears? Maybe. Will there be pain? Yes. Will there still be fear? Yes. But fear is a good thing. It keeps us alert. It keeps us on those appointments. It keeps us alive. It keeps us communicating. We need to feel that, but we need to understand what triggered it and then move forward. I love this. This is Abraham Maslow's Hierarchy of Needs, and I think I learned this in Psych 101. And what happens here is we all as human beings have these needs. The bottom need is basically the least important, yet many of us will see that it grounds us. So we have the physiological need, which is the human survival of air, food, clothing, shelter. Those are your basic survival needs. We all need them. Then we go into safety and security. This is where breast cancer starts shaking the pyramid. Now, if you have a strong foundation and you have a strong relationship, then you survive this. But if not, it becomes a very tough ride. What we find is that the financial aspect of it becomes a burden for both of you. We find that obviously the health has now been shattered. And then we feel that our safety net has been pulled away from us. So that's the second level you can see right there, going from the bottom to the top. So our safety and security now has been disrupted. Now we look at love and belonging. So now when we take a look at there is love, there is belonging, and I love it that it's centered because it is the true foundation of the entire process of the survivor feeling that they're doing what they want and that you're appreciating it and that they're fulfilling the role that they've been given, this new identity. And if we've ever questioned our identity, all of us who've been through those 20s and we become interning adults and we need to learn how to have society accept us, we realize that belonging is key. At times we find that the survivor feels as an outcast. He's outside looking in. You have your support system, you have your breast cancer buddies, you have your doctor who understands you, your nurse who understands you. They feel like you feel that that you don't understand them and that they don't understand you. So there's a component of loneliness that takes place within the survivor. Then we have self-esteem. If we don't know what we're doing, how well can we feel that we're doing a good job? So how many of us through the process really tell the caregiver, yes, you're doing a great job? Happens, but doesn't happen. Obviously 11.6% of the time, it probably doesn't happen. And then, self-actualization. And this really, we start realizing when everything is said and done, our treatment's done, we move on to our normal life. With many of us, it's as soon as we're diagnosed. We're diagnosed and then we go back to work. And that's just the way it is. But then we become full. So once we turn around and we go through the whole treatment pool, what we find out is that how well did the whole family feel about being self-actualized? Were they stronger as a family, or did it start breaking? Okay, so these are the statistical parts, and these are the psychological terminology. When it came, I don't know if Russell said or didn't say, he probably did, but I was diagnosed in 2009. My mother was diagnosed in 1999, and I had my surgery in 2010. And to find the caregivers, I had amazing caregivers, and I'm going to point them out to you right now. There's Richard Zadak, my husband over there, Angelica Zadak, and Alexandra Zadak over here with the pictures. And the key is that there's a huge trust factor that goes into all this. And when we look at the whole picture of our psyche, we need to trust. And if we lose the fact of trusting someone, then that's where our loneliness comes in. Survivors also need to trust that they're doing the right thing for you. I don't know that I could have ever done a good job of saying, even with a therapeutic background, you have done such an amazing job and I trusted you, but I literally gave my life to them to help. And that's very tough when you turn around and you see that you have to give so many components of your life to them to do when you've done it on your own for so long. So it becomes very, very challenging, very, very emotional. And gratitude is something that you'll be doing for the rest of your life. Now, I've said all these, things about what the caregiver goes through, but there is an app to make things transition easier. And I find this interesting because we were just talking about it, Jane and Angela over there, we were just talking about it in the back about how, technology plays such a big role in our life. And we need these tools. We are only as good as our tools. It's that simple. If we don't have the right tools, the right doctors, the right caregivers, the right support system, we cannot perform 100%. And it's very low. So now what I find is that since how many of you have cell phones? That's what I thought. That was a trick question. Okay, so if I were to ask you to give me your phones, wouldn't that feel a little intimidating? That's pretty personal, right? So what if we take these feelings we have and we use, and it's shaky because I'm telling you to stay away from technology and connect with people many a times in my lectures, and now I'm telling you, wait, disconnect from the world, but go to technology. And these are the apps. There's this Cancer Coach app that I looked into, and I think it's phenomenal. And what the app does, it helps you explore many things having to do with breast cancer. You can you can create a support system. You can have meditation. You can have music. You can have texting back and forth. You can have a calendar of all your appointments. You can do research on it. There's so many things to this app. How great for a caregiver to have. What a relief. It's like their partner in crime, if you will. To be able to have something that if the patient, their family member, isn't responding the way they would emotionally, they're doing great in treatment, but the emotional aspect is very challenging. The psychosocial part of breast cancer is crucial for us to understand. I believe it was Maxine who said, or maybe it was Dr. Wine. What was the first speaker? I'm sorry. Weingrab. What happened was that there's the bottom level. Well, you need to start from the top. Our mind controls so much of our healing process, and we definitely need to take that into control. And if we need to use our cell phone to do that, I am 100% for it. Use the tools that you need to help you through the process. So take a look at these if you have an opportunity. Cancer Coach is the best one, and then you'll have the Serenity Scene. And these seem to be very, very helpful especially with meditating or just needing that time to take a walk and listen to music. Now let's talk about the believing and being in the zone. Again, the mind. First you think, then you feel. Very, very, very important. So how many of you really knew through the whole process, because we're so involved in what we're doing with our health and taking care and the healing part, what was our survivor thinking? What was the survivor thinking, and how does the caregiver know what you're thinking? They know you're going through pain, your fear, and you're stressful. But what are your real thoughts? There's just no way. We can't share all those thoughts, and our imagination goes wild, and every time our finger hurts, we think the cancer's come back. And that's just the reality, any pain. So the survivor becomes very overwhelmed. But we need to understand how is the caregiver. I'm going to make a quick disclosure, by the way, so that I told Russell I was going to make it. I got bit a few minutes ago, and somebody gave me a Benadryl. So if I lose my train of thought, so it's a lot better now, but it was very, very swollen. So I don't know. I don't know what bit me. I don't know what happened, but my hand was swollen, and Angela was kind enough to go and run and get me a Benadryl. And all these caregivers were helping me. So it went full effect in here about 45 minutes ago. So when we take a look at the believing zone of the caregiver, what we want to do is we want to understand that it shouldn't be that different from us, because most of our caregivers are people that we're close to. So it shouldn't be that different, but for some reason, there's a disconnect that starts. And I believe, and we've seen through research, that what happens is that their belief system shifts and it becomes a little insecure. So they really don't know how to act. And then what happens is that then there's that disconnect. Someone that we had a great relationship with, there's a shift. There's a shift in belief system and action. Healing through art. If you have children that become caregivers because they do in their own way, healing through art is wonderful. And Bernie Siegel has an amazing book about that. And I went through that with my journey. I would sketch every morning about my surgery because I was so afraid of the surgical process, most of all anesthesia. So I drew stickmen because I don't know how to draw, and I would draw myself in the surgical room with the anesthesia machine and the anesthesiologist with big smiley faces, and they were really, really happy. So I walked in knowing that they were just going to be the happiest people in the world. And again, a special thank you to my healing team, which is over there, and there they are again. They helped me transition through many, many, many moods of being afraid. Thank you. Any questions, comments, concerns? Want to share a story? No, good. Thank you. Yes, ma'am. How old is he again? Okay, so what's your name? Cassandra has a 28-year-old son. So yes, men are very different. The way we describe men, at least in layman's terms, is I think of a man's brain is made out of compartments, and they pull one drawer at a time out. That's it. So what happens is that when that compartment's out, nothing else can go on. So you're probably pulling a lot of compartments at the same time, and they're all empty, because he can't do that. Now, a female's brain is all wires, and it's constantly going and going and going and going and going. And so you're thinking this way, and he's at a totally different level. Unfortunately, you have to start thinking like him, which is one task at a time. And what I mean by task is not an actual task, but an emotional task. And that takes a lot. Because you have to be patient, and you have to be patient, and you have to be patient. So that's how it happens. Any other questions? Yes, sir. Please, yes. Thank you so much. And see, that's a perfect example. That's a perfect example. Thank you so much for sharing that. And we forget, they really are our unsung heroes. They're behind the scenes 100%. You have to think of breast cancer as some type of a theatrical show. And what you do is you're on stage and you're the actor, but what about all the others that are doing the lighting, the sound? You wouldn't be as successful as you are without them in the background. So a big hand to all the survivors here. Thank you so, so much. Thank you all for coming, and I'll see you soon. No, I'm going down.
I think the expression is real men wear pink shirts. So before Jane Torres and Kathy Durham come up to introduce our next speakers, which is in just a moment, I just want to remind everybody that we do have a raffle or drawing as soon as the presentations are finished, and we have some great things that we're raffling off, including 4 one-day passes to Disney World, which for Florida residents, you know how much that costs. Disney was kind enough to donate the 4 passes, and that'll be the last thing we draw in the drawing. So if you're at all interested in that and some of the other wonderful prizes, please see those who are selling the tickets and all the way over in the corner and take advantage. And in addition to the shirts, limited edition T-shirts. Yes, they are. They're limited edition. We'll probably come out with a different car in next year. So buy this year's, and we'll see what happens next year. So without further ado, I'd like to call on Jane Torres, our founding member, and Kathy Durham, our immediate past chair of our board, to make the introductions.
Hi again. Before we tell you about all of Ron Book's accomplishments, I want to tell you about probably my very favorite accomplishment of his, and the accomplishment that means the most to the Florida Breast Cancer Foundation. If it weren't for Ron Book, I think I can honestly say we probably wouldn't have the breast cancer license plate. So we have a lot to thank him for. And it happened like this. Back in 2001, a couple really smart women noticed that the Panther license plate was earning $1 million a year to save the Panthers. And they came to me and they said, so maybe we could earn $1 million to save the breasts? And from there started the idea of getting an breast cancer license plate. But in order to do that, we needed to have $60,000 for an application fee. We needed 30,000 signatures, and we needed the Florida legislature to pass the bill. Needless to say, we were having a hard time doing all that. And then we got a phone call from Ron Book. He had seen a piece on television about the Florida Breast Cancer Foundation and what we were trying to do in terms of getting the license plate. And he said, I'd like to help. And that's exactly what he did. He helped us get the money, he helped us get the signatures, and as probably the best lobbyist in Florida, he helped us get the legislature to pass the bill. That was in 2002. And as you've heard, since then, we've earned over $6 million and given out $4 million in grants. So it's a very important accomplishment for all of us. And where is Ron? Oh, there you are. Thank you, Ron. Thank you, Kelly. And now Kathy will tell you about all his other accomplishments.